Well, thanks for being with us here on Morning Live. One more interview to squeeze in now. Echoing Health Minister Dr. Zweli Mkhize's call for children to be vaccinated, our next guest says that the coronavirus outbreak serves as a valuable reminder of the important role that prevention plays in the protection from infectious diseases, and that parents should be made aware that it is vital that routine immunization of children is maintained. And joining us now is Dr. Nasiha Soofie, the country medical head of the vaccines unit at pharmaceutical company SANOFI. Thanks so much for speaking to us this morning.
Thank you so much for having me.
So perhaps a good point to start, Dr. Soofie, is around this debate that parents have been having of late. There are, of course, the anti-vaxxers who say that vaccines actually cause disease and harm to children. How exactly do vaccines work?
So there's two ways in which I would like to answer that question. So to answer your question with regards to how do vaccines work, so basically a vaccine is a medical formulation. And what this formulation contains is a killed form or a modified form of the actual virus or bacteria. And so when this formulation is injected into the patient or into the body is fooled into thinking that it is being attacked. And so it mounts a massive immune response and creates a whole lot of antibodies that lie in wait to fight off the virus or the bacteria. But was the virus or the bacteria which was injected was actually a dead or modified form of the virus or the actual bacteria. And so what happens is after you've been vaccinated and now your body is ready to fend off that infection, should you come across someone who's infected with flu, for instance, and you become exposed to the actual flu virus and that virus enters into your body is ready and prepared to neutralize the virus, and therefore you will not become ill. So that's the basic concept around how a vaccine works. Now, the second way I'd like to answer this question is specifically in response to the vaccination campaign. To any parent, to any individual who's hesitant, who is two-minded about vaccination, please may I remind you that human beings on an annual basis die by the millions as a result of viral and bacterial infections. As human beings, we are arrogant species. We think we rule the earth, but actually we live at the mercy of viruses and bacteria. Many of these bacterial and viral infections are incredibly challenging to diagnose clinically or in the laboratory. Clinical symptoms are very often ambiguous. Even if it is correctly diagnosed, treatment is not always a guarantee. Even if someone receives treatment for a viral infection or a bacterial infection, it's not a guarantee that they will recover from the illness, which is why immunization is really the only tool we have. Vaccination really is the most impactful tool we have to protect ourselves as a species, and can be no more significant than during the current context of the COVID-19 pandemic.
Dr. Soofie, do you have any idea of how big the problem is with regard to, or maybe I shouldn't characterize it as a problem, because for those who believe that they shouldn't be vaccinating, they have a right to believe what they want. But as a percentage, perhaps, how many people are opting not to have their children vaccinated in South Africa? Because I can remember when you went to school, or, sending one's children to school, they actually demanded an immunization card, without which you had problems in getting your child actually admitted to the school.
So currently, we are waiting for the results to be published from a vaccination coverage survey, which was conducted in the country. And until we have those results, we cannot really say with any confidence what percentage of individuals are opting out of vaccination. But looking at previous trends, we know that the anti-vaccination campaign in South Africa is not as prolific as we are seeing in first world countries, which is a comfort. Now, to the second point with regards to mandatory vaccination, we need to be aware that in South Africa, vaccination by no means is mandatory. So it is not mandatory for any South African citizen to receive a vaccine. And of course, this makes sense because there are certain individuals who may have allergies to certain vaccine constituents and so forth. But my suggestion would be that if you are a parent who has been sort of influenced by these anti-vaccination sentiments, is to ensure that you have a balanced view. Have a consultation with your physician, someone who is medically trained, to ensure that you are taking the right decision for your child. Because may I remind you, vaccination protects one against some very, some very life-threatening and debilitating illnesses, such as meningococcal meningitis, which can kill within 24 hours, influenza, which kills approximately 12,000 South African citizens each year, God forbid polio. So really, as a mother, as an individual who is opting out of vaccine, you need to be very mindful of the decision and the repercussions of the decision you are taking.
So we were listening earlier to Health Minister Dr. Zweli Mkhize, and he also makes mention of the point that because of COVID-19 right now, people are afraid, parents are afraid to go to hospitals and clinics, Dr. Soofie, because they are afraid to contract the coronavirus and also expose their children to this. Now, are there time limits as to when children no longer develop antibodies against certain diseases?
No. So my message to parents who have abstained from vaccination, and certainly we have seen since the beginning of the lockdown period, in the very early stages of the lockdown, we already saw a 26% decline in immunization because parents are very fearful to take themselves, their children into healthcare facilities. They see healthcare facilities as hotspots for where COVID-19 cases are going to congregate to get care. So they feel if they take themselves and their children into healthcare facilities, they are going to expose themselves to the virus. But what we need to be aware of is that if we abstain from vaccination for too long, we are creating the perfect environment for outbreaks of diseases which are very easily prevented by vaccination. Like I said, polio, for instance, whooping cough, measles, diphtheria. Now, can you imagine an outbreak of a disease that's easily prevented with vaccination on the back of a COVID-19 pandemic, where currently our healthcare infrastructure are already under strain? So my message to those parents who've abstained from vaccination, it's never too late. The worst you can do is not to vaccinate. There's no such thing as, oh, if you give the vaccine too late, you will produce no antibody response. My advice is try as much as possible to stick to the recommended timelines for vaccination, because that is when the vaccine works optimally. However, if you've missed a vaccine, do not fail to ensure that your child is vaccinated, even if it is late. The worst you can do under the current circumstance is to abstain from vaccination altogether. And remember, vaccination is not only for children, it's for adolescents, adults, and the elderly as well.
Well, Dr. Nasiha Soofie, that's all we have time for. Thank you so much, Country Medical Head for the Vaccines Unit at the pharmaceutical company SANOFI, talking to us about the importance of children still receiving their vaccines even during this COVID-19 pandemic. All right, let's quickly just recap.